The Secretary to the Government of the Federation and Chairman of the Presidential Task Force, honorable ministers here present, particularly my dear brother Malam Adamu Adamu, Director Generals, members of the press, ladies and gentlemen. As of today, the 14th of April 2020, a total of 343 COVID-19 cases have been confirmed, 91 patients discharged home, and 10 deaths recorded in Nigeria. Yesterday, someone had asked if the other figure we had, the lower figure we had, was an indicator of something, and I said no, there will be fluctuations to be expected at this phase. The 20 new cases were reported from 5 states: Lagos 13, Edo 2, Kano 2, Ogun 2, and Ondo 1. 73% of the cases are male and 27% female, a more or less constant ratio since. And the most affected age bracket is 31 to 60 years, which are also the most active and productive age group in any community. We have increased daily testing capacity by activating more COVID-19 capable laboratories and shall work with the private sector to outsource and diversify sample collection sites and also improve logistics support. Details of sample collection sites will be made known in due course by the NCDC. Increase in the number of discovered cases could be the fallout of improvement in testing capacity. We are gathering more epidemiological information on coronavirus disease, such as understanding the sources of new cases and planning new lines of action. We shall continue to aggressively pursue our policy to detect, test, and isolate cases. We have early evidence of community transmission already, which reinforces the urgency of physical distancing, use of face masks, particularly where you know you cannot avoid a crowd or where you know that the contact will be forced, like in market or shops or in public transport if you need to use one. And also the maintenance of hand and respiratory hygiene, as well as strict adherence to measures and regulations as announced by His Excellency the President yesterday. From a medical point of view, I wish to again emphasize that these measures will reduce the risk of positive persons carrying the virus from one place to another, especially those who are asymptomatic and may not know that they harbor the coronavirus. Staying at home also increases the probability of tracers finding persons of interest at home when they call. I therefore urge citizens to take these measures in good faith as announced by the President. We have made significant progress in contact tracing and have to date followed up over 9,000 persons of interest, most of whom have exceeded their 14 days of observation period. Nigeria Center for Disease Control is doing a very good job of supporting response activities in states with new outbreaks, with their rapid response teams, and working with the Department of Hospital Services of the Federal Ministry of Health to oversee the establishment of more isolation and treatment centers in line with national guidelines and global best practices. I must at this point commend persons, organizations, and groups in Nigeria who have put public and even their private facilities at the disposal of Federal Ministry of Health to use as isolation and treatment centers, and in some cases have gone out of their way to renovate and equip such centers. The treatment center accreditation team has set up the guidelines and the maintenance and operational standards that are to be used in all isolation and treatment centers, both private and public, so long as they are eligible. I remind practitioners to take utmost precaution as COVID-19 is a highly transmissible disease with national security implications. The Accreditation Committee shall conduct random spot checks to ascertain the state of readiness of isolation and critical care centers in the country. However, improving testing capacity alone will not yield full value if it is not followed up with isolation. I therefore urge all citizens to cooperate with the Ministry of Health officials when it comes to inviting you to isolation, and know that it is for the good of the entire country. The Federal Ministry of Health has mapped out areas of need in ICU capacity, and we work with the Medical Association of Consultants, and also the Nursing Association, and also the Association of Anesthetists and Critical Care Physicians and Nurses, with the aim of deploying specialists to areas of need for limited periods as a sort of national service to enhance readiness and to build capacity, and also to work out modalities for conducting crash courses in local hospitals. Similarly, the ministry is creating a structured patient transport plan within the new Federal Ministry of Health Action Plan, which we are working on, which is to be shared with all states. This is important in the need, if the need arises, to transfer patients from one center to another. The Federal Ministry of Health and its agencies are developing also this new action plan as a strategy to respond to the imminent phase of COVID-19 community transmission. After all of this, we're also planning a National Council of Health, which will be held virtually, that will allow us to take in the preparation plans of the states, and also to transmit and translate our plans and share with the states. I wish to thank all our health workers for their commitment to the response, as well as our stakeholders, development partners, of whom today a group came to visit us at the ministry and gave us advice and also offered us technical support. Finally, I wish to commend all Nigerians for their sacrifice, for the sacrifice we are making towards ensuring the defeat of the virus. As the President has said, by working together and carefully following the rules, we shall get over this pandemic and emerge stronger in the end. Thank you. I shall now invite the Director General of NCDC to follow up.